Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, a cardiologist from Houston, Texas. I've been in practice for more than 44 years, and this is one of the most significant changes I have seen in the medical field that is being executed by President Donald Trump on March 12, 2025. Pharma executive order signed by President Trump. We are going to go into the details of this particular executive order, how it affects prescription prices, who are the people who are going to be affected, who are the people who are going to be benefited, and how much benefit they can expect from this executive order. So let us begin with the main feature presentation. President Donald Trump's latest pharmaceutical executive order, signed on May 12, 2025, is a sweeping directive aimed at lowering prescription drug prices in the United States by aligning them with those paid in other developed countries. Here's what it means for American consumers, how it would be implemented, and what is to be expected, the impact especially for senior citizens. As a practicing cardiologist, I can say this is one of the most significant actions taken by any president in the past 70 years on healthcare in terms of reducing the cost of prescription drugs for senior citizens. Some of the drugs cost, like heart failure drugs, cost as much as $6,000 per year. Just one medication I'm talking about. But ladies and gentlemen, hopefully with this new executive order, those prices are going to be dropped significantly. If you're not aware, the same pharmaceutical companies manufacture the same drugs and ship them to other countries, developed countries and underdeveloped countries, to a tune of 50 to 75% cheaper than what they charge you, the American consumer. And this is what the President Trump's bill addresses. These pharmaceutical companies have been skyrocketing prices with ruthless windfall profits at the expense of you and me, the American consumer. What it means and how it benefits you as American consumer. If it is signed, it is already signed. So we're going to move to the next slide. What it means to an average senior citizen in terms of cost savings per year. Let's take a deep dive into this. This executive order directs the pharmaceutical companies to match the prices they give to the most favored developed nations. Unlike previous efforts, the order targets not only the Medicare patients, it also targets the Medicaid patients and also the private insurance companies. All of them would be having this blanket effect of the executive order. The Department of Health and Human Services will give drug makers 30 days to voluntarily lower their prescription prices to the new targets. If they do not comply, HHS will move to enforce the most favored nation practicing through regulations, bypassing the middleman. I don't know if you're aware of, when the drug companies manufacture the drugs, they go to a wholesale distributor. From the wholesale distributor, it goes to the middleman. From the middleman, it goes to the pharmaceutical companies, for pharmaceutical drugstores. And there is markup at every level, and President Trump wants to cut off all this red tape and have the drug companies sell their drugs directly to you, the consumer. By doing so, Trump expects to reduce the prescription costs by 30 to 80% on certain drugs. When the total prescription costs are going to come down, it is also going to lower your out-of-pocket money for these pricey prescription drugs. That's history anyway. It also expands the market available for people to buy the medications. If they can buy the medications directly from pharmaceutical companies who manufacture these drugs, there's no need to be going through multitude of different prescription plans and then paying yearly fee to the other institutions like drugstores or grocery stores. You can cut all this nonsense and buy your drugs directly from the insurance, from the manufacturers, so that they will be delivered to your door on a timely basis. Timeline for effectiveness. As I already mentioned, the drug companies will be given 30 days to comply with the new favored nations prices, to bring down their drug prices to match with the prices they charge for the most favored nations. This will be enforced by the Health and Human Services, and they'll be given up to 6 months to implement these new regulations. Otherwise, they are going to be held accountable, and there may be lawsuits filed against these drug companies for this ruthless runaway prices. Impact on the average citizen. Potential annual savings of $600 to $1,000 per year out-of-pocket prescription drugs, and 30 to 59% reduction in the annual savings for seniors, about 150 to 590 per senior, with some savings even more depending upon the type of drug you're using. If you're using heart medications, which cost thousands of dollars, a new heart medication will cost you more than $6,000 minimum. And this is a big rip-off. Ladies and gentlemen, believe me, this is a huge rip-off. And this is because the same drugs are being sold for like 80% cheaper in India or any other foreign country. These drug companies cannot do that. And I think Trump has the best thing in his heart to help the senior citizens. When will we see the results? Short term, we should be able to see the results within a few months. In the medium, it may take 6 months or longer. If there are legal challenges, the federal government will be ready to fight all the way to the Supreme Court to make sure these drug prices are made in compliance with the most favored nations in the world. So this is an executive order which is going to have a sweeping reforms as far as the prescription drugs are concerned, because if the drug companies have been ripping off, they are ripping off Medicare and Medicaid the most, because these are the populations that use the most of the drugs in any given time of their life. So ladies and gentlemen, I applaud this President Trump's Pharma executive order. As a cardiologist, I couldn't be happier today than I have been in the past 44 years practicing cardiology. And to summarize, Trump's executive order aims to dramatically lower the US drug prices by trying them to the lowest price paid by other developed nations. Drug companies will be given 6 months to comply with these rules. Otherwise, they will be taken all the way to the Supreme Court, I'm assuming. Let me know what you think about this. This should have a direct effect on your drug prices, your pocketbooks, and your savings. I am so glad to see this one. So, ladies and gentlemen, you have been watching a presentation on Pharma Executive Order by President Trump, signed on May 12, 2025. That is today, as I am recording this video. And I will see you in the next presentation. Thank you so much.